Welcome to Global Medical Office Dialogues. The effects of climate change are undeniable. Does a changing climate require new approaches to managing patients with end-stage kidney disease? Phenomena such as extreme heat events are increasing in frequency, duration, and intensity, and the trend is projected to continue. In this edition of Dialogues, we talk with Dr. Peter Kotenko, Research Director at RRI, the Renal Research Institute, about the effects of extreme climate events on vulnerable patient populations. Dr. Kotenko recently co-authored an investigation exploring the association between extreme heat events, hospital admissions, and mortality among patients with kidney failure. I'm here today with Dr. Peter Kotenko to talk a little bit about a topic that he and I were co-authors on a paper from last year on the impact on our patients requiring dialysis of severe heat events. And this brought to mind a conversation around what the impact of climate change might be on patients with end-stage kidney disease or advanced kidney disease, recognizing that there are so many features to this rather global and substantial problem that I thought we could try to get your insights, Peter, on this.
Yeah. So let me start by saying that the vulnerability also of the general population to extremes of heat has steadily risen since the 1980s. So, for example, the average human being globally is currently experiencing something like 1.4 more days of heat waves compared to 25, 30 years ago. So this is a dramatic increase in the exposure of the population to heat waves. And some of us may remember extreme heat waves in Europe, in France, in the early 2000s, where tens of thousands of people, estimates vary between 20 and 40,000, passed away because of extreme heat events. And I think it's conceivable that a vulnerable population like our patients who suffer from chronic kidney disease are particularly vulnerable. And why is that? Well, a part of the body's reaction towards heat have to do with involve the function of the kidney. And by conserving water, urine production goes down, for example, by excreting certain hormones that would adjust or assist in the adjustment of the body to heat. So, and it's conceivable that our patients with the loss of kidney function and on top of that, many comorbidities, as said, are particularly vulnerable. So what we have shown, Frank, in our work, and this was done together with colleagues from University of Maryland and Boston University, is that extreme heat events actually are associated with same-day rise in hospitalizations and mortality. Now, extreme heat events, there is several definitions there, but in our work we use the definition that the heat on this day was above the 95th percentile of the maximum heat events on that specific day in the past 30 years. And I think it's the first step to improve things is, of course, to recognize them. And this work, I think, which is highly referenced and was widely distributed in the community, was one of the early works that really pointed towards the effect of heat waves on dialysis patients. There is, of course, the effect of heat waves also on non-dialysis patients and those with early stages of chronic kidney disease and those without kidney disease. So, for example, this phenotype, or this entity of Mesoamerican nephropathy, that's a chronic tubular interstitial nephropathy that's particularly observed in males, predominantly working under hot conditions, on sugarcane fields, and who don't have access to enough fluid to drink. And that for those people, actually, heat is the upstream event of kidney failure. Same thing has been observed in India, in Sri Lanka, in Mexico. So there is now really increasing evidence that exposure to heat, especially when combined with poor access to fluid or rest, that this can really impact the kidney function through multiple pathways.
So one of the key questions I think we've got to ask as a field is, independent of the political discussion about whether climate change is occurring, if we just assume that it is occurring because the data indicates it is, to what degree should we or could we actually begin to look at how do we address the health effects of the patient's growing inability as their kidney function deteriorates in accommodating to extreme heat events that individuals without kidney failure seem to adjust to quite a bit better? And to what degree can we actually define a clinical pathway that might actually help patients as they struggle through these kinds of heat events?
Yeah. There is a few things. So first, I think it's the first step is that we as a medical community become more and more cognizant that heat waves affect health. And so that, in other words, that we start to put emergency plans into place, and I'll come to those plans in a minute, that will help us to safeguard, to protect our patients. And this is the same for CKD patients without, not on dialysis, but also for dialysis patients. I guess it's true also for patients with congestive heart failure and many other chronic conditions. Now, so this is the recognition of the problem and and having alarm plans in place. Now, the other thing is there is clearly, and data show this, an overlap with social determinants of health. That, for example, patients who have no access to air conditioning, to cooling, who have not access to sufficient amount of clean water, that those patients or people are particularly vulnerable. And I think that's something we also have to think about when, for example, we start develop action plans for our dialysis facilities. Should we, just as an example, actually allow more fluid intake and in our patients when heat waves are announced? Just as one example. Or should we specifically recommend patients to stay indoor and seek places where they have access to air conditioning? So just as few examples there. But I think there's a need to develop something like this. And I know from a former fellow who was here at the Renal Research Institute. She was from the Netherlands, and she told me and shared with me that in the Netherlands they have developed some heat emergency plans for nursing home facilities.
So we've been discussing, in the midst of the COVID-19 pandemic, what kind of emergency preparedness plans we can have for potential future events. We know that we have disaster response plans for other natural disasters like hurricanes and tornadoes and such things. It is very interesting to think about what other population, social kinds of stressors that could occur, like heat, generate and trigger very specific plans to try to protect individual patients, but also the population of patients. So it's a very interesting concept.
And actually, so we have entered now in conversation with the disaster preparedness group within FMC, and actually heat waves were now added to that list of disasters like the ones you mentioned earlier. And so we have started now a collaboration with experts from the Maryland University, Boston University, but also a group in Beersheba in Israel that has a lot of experience with the physiological response of humans to heat waves. Because of course, Beersheba, the south of Israel, is affected by heat. And so I think that out of such a collaboration, we will be able to develop actually plans for our many patients, not just here in the US, but also globally, to give some guidance what to do if, say, a heat wave is predicted to occur in the very near future.
Yeah, so I think that as we look forward at some of the things that we want to talk about at various larger events within the field, whether it's a medical symposium meeting or a discussion with our colleagues in the field, this is a nice topic, I think, for us to try to expand upon that you've brought up here with me today on this dialogue series. Thank you very much for kind of bringing this forward. I think it's an interesting topic that connects into our social determinants topic and what our responsibilities in population health are. So I appreciate your time today and your insights. Any final comments and thoughts about these kinds of efforts as part of our healthcare and science responsibilities that we have?
Well, I think that with respect to the effects of climate change on patient outcomes, this is something where it's high time to really start thinking about it, about the many dimensions, even beyond heat waves. This has to do also with questions like water scarcity in certain areas where we as a company are active. It's a topic that will be with us for a long time, and I think we as a company are taking the right steps to address it. And my hope is that in the not distant future, we will be in a good spot to come up with solutions that at the end of the day will help to protect our patients from the effects of extreme weather events.
Peter, thanks for talking with me today about these interesting topics and some of the challenges that we have facing us in the future in coming years.
Thank you, Frank, for having me.